Hi guys, this model I call the big Swedish fish model. It's a great hip model that has a lot of the muscles on it, especially this hip flexor group. So here you can see the pubis, arcuate line, iliopubic eminence, pectineal line, iliopubic eminence, arcuate line, and then the iliac fossa under here, and the ilium. Okay, all these red marks are going to be attachment sites. If you see any blue, so like there's some blue shading right there, that's going to be a distal attachment. So an origin and an insertion, for example. Now here, this is part of the collective group known as the hip flexors. There's a lot of additional muscles that also flex the hip, but these two in particular create the functional group known as the hip flexor. This is your iliacus, and his proximal attachment is going to be that iliac fossa down to the lesser trochanter of the femur. This one, though, that's your psoas major, and his proximal attachment comes all the way up here to the lumbar vertebra, which you cannot see on this model, but to the transverse processes of the lumbar vertebra. They converge together down here and both attach to the lesser trochanter of the femur over the front of the hip, crossing that joint, producing flexion when they concentrically contract or shorten. Okay, now let's look at the back of the model. You got to think this is really more the side. This is really more the side over here. You can see glute max here has been cut. He's huge, and he would come way over here and attach down here to the gluteal line and the gluteal tuberosity right there. If we chopped him off, which we did here, you then can see gluteus medius. Now what's really great about this model is that we can take these off and really look at the attachment sites. So I want you to remember, though, the gluteal surface of the ilium, you've got gluteal line, so that's going to be your posterior gluteal line. Now let's take off glute medius, and then we're going to be able to see, put it in the light, you can see it a lot better. You can see that there's separation here. See that line right there? That's showing you that there's something beneath gluteus medius, that's gluteus minimus. And notice that curvature of that attachment site. Notice this attachment site as well. Those are the margins of attachment for those. So now let's look back at the bone, and you can clearly see the posterior gluteal line, the anterior gluteal line, and the inferior gluteal line, all three of which correspond to attachments for your gluteus medius and minimus. So from the posterior to the anterior gluteal line, that's the attachment site for gluteus medius. From the anterior gluteal line to the inferior gluteal line, that's gluteus minimus. Again, this is gluteus maximus, which has been cut, but it would cover all of this. If we remove all of that, you can also see the external rotators. Now remember, again, there's extra muscles that externally rotate the hip. Your butt helps rotate the hip laterally. The lateral hamstrings help rotate the hip laterally. Your sartorius, there's a whole bunch, but just like the hip flexor, this group, which there's actually 6, they never show one of them though, so this group of 5, they're known together as the functional group called the hip flexors. P-GO-GO-Q is your acronym for those muscles. Since the obturator externus is never shown on a model, what you're actually going to see here is P-GOG-Q. Piriformis, gemellus superior, obturator internus, gemellus inferior, and then quadratus femoris. Okay, now let's look at this obturator internus, because he wraps around the inside of the pelvis and attaches to the inside of the obturator foramen. So you can see my finger sticking out. So that's the obturator foramen right there. And the obturator internus comes around and covers the inside of the obturator foramen, hence the name obturator internus. The externus would come through and attach to the external surface of the obturator foramen. And those are all of the muscles that you would see on this model.